Welcome, I'm Emily Tish Sussman, host of your Political Playlist podcast. To say that the COVID-19 pandemic has changed the world would be an understatement. We've seen a healthcare crisis, job loss, mounting educational inequities, and social isolation, to name a few. Although we have a new president, it's clear there's not a one-size-fits-all answer to any of these challenges. So today I'm very excited to be joined by this panel who's going to share with us some of their best practices in discussion, both over the last couple of months, but also throughout their careers. So we're going to have our panel introduce themselves and also answer a question for us: what has changed in the COVID-19 era, but what has also not changed in terms of challenges? So to start, to kick it off, I'd love to invite Lauren Birchfield Kennedy to join us.
Hi, I'm Lauren Kennedy, the co-founder of Neighborhood Villages. We are a nonprofit working towards a world in which all families in America have access to affordable, high-quality childcare and early education for their children. Something that stayed the same during the pandemic is that childcare has always been a system that has been undervalued, overlooked, underfunded, even though it is essential infrastructure, foundational to family economic security, to the economy generally, and certainly the best investment that we can make in children for their education success and their health and wellness outcomes over the lifespan. So while that didn't change, what did, I think, is the finally shedding a light not only on how childcare and early education hold up a family, but how it is also essential to all the work that we are doing to promote health equity and health justice. So what I've been happy to see is maybe for the first time taking a close look at how investing in childcare centers as taking a place-based approach to social determinants of health and family prosperity indicators, that we can really tap into this potential that we've seen blossom during COVID and make a long-term investment in it.
Vanessa?
I'm Vanessa Carey. I am a physician. I am the co-founder and CEO of Seed Global Health. We're an organization that partners with governments to ensure that they have the healthcare workforce that they need to respond to the most pressing health problems and to help save lives. And I'm also a mom of two. I think that COVID-19 has been a very, very interesting moment in our lives, because what it's really highlighted is that it has really shown a light on the profound inequities in our society that also play out certainly in healthcare and through this pandemic, where you've seen more brown and Black people die, people who are vulnerable have been more susceptible. It's also shown us how I would say woefully underprepared we are in our public health system. And much like our education systems and our health systems have both been exposed as being underfunded and underprepared to really serve the kids and the people of this nation and the world that need an education, that need an opportunity to health. But it also highlights opportunities in many ways of things that we can work on to fix, and the opportunity for us to start to do better and to make appropriate investments in areas like early education, like building up our public health system and really valuing the power of health. The thing that has been frustrating for me, especially during COVID, is how health and science has been politicized, and we've lost the ability to trust fact and to understand what keeps us safe. And I think that even today with the new administration has remained the same. Many people are still skeptical of science. And that highlights for us the deep challenge of how do we communicate and how do we process information and how do we build trust to be able to take the right action. And again, these are all opportunities, but it's been a very fascinating moment in time, but one that I think allows us to rise to the challenge.
Courtney?
Hi, my name is Courtney Cabot Venton. I am an international development economist, and most of my work has been with large donor governments and foundations, really working on the evidence base around what works and also what doesn't when it comes to poverty reduction globally. I am also the founder of a nonprofit called the Share Trust that invests in women's empowerment collectives. They're also called self-help groups because of their transformational effect on health, as well as many other positive outcomes that they bring. I'd say the biggest change as a result of COVID that I have seen in my sphere of work has been a fundamental shift towards recognizing the critical role of local actors. And it's really taken COVID to shine a spotlight on this. So community health workers and women's group members. When COVID hit, the international system pulled back all of its international staff, and even local staff in cities couldn't travel out to more rural areas. And this really highlighted the critical work of communities, and I would say has prompted a real reckoning by the international community around our failure to live up to commitments to channel far more funding and power towards those on the front line.
Raul?
Yes, my name is Raul Perhagene. I'm a global health physician, and until very recently, the Deputy Mayor for Health and Human Services for the City of New York. I like the format, both. Number one, thank you for inviting me to be part of this panel. It's really interesting for me to see all the different perspectives. And I was going to start by saying what has not changed is the most basic principles of public health still continue to apply. A year ago, we knew very little to nothing about this virus, but we started reminding people that washing their hands, not touching their nose and mouth, etc., was still at the core of trying to, stay healthy. Social distancing and now more of the mask wearing is still the cornerstone, still very important. Now, what has changed, I think a couple of you have mentioned this, every crisis brings opportunity. And from my perspective, I realized that, at least for the city of New York, I couldn't only think about the public health of the city and the people who live there. I was working with all of my colleagues and all of the not-for-profit, all the foundations, and all the private sector to make sure that as a community, we all came together to try to see how we could resolve this. So what is coming down the line, a couple of you have mentioned, is great hopes for the new administration now acknowledging more science. I think we still need to do more work on trust, particularly in underserved communities, but also more importantly, testing and vaccine are going to get us to normalcy again, hopefully by the summer. The administration has said 1.5 million vaccines a day. It's a very tall order. So we need to make sure that the entire communities, with all of these sectors, the not-for-profits, the foundations, the private sector, the government, come together and find the people who are going to organize how to get the vaccines and the testing to everyone. So we all get there. If we only protect our vulnerable, the elderly, the minority communities with comorbidities, but we don't pull together, I think that's the key that I would like to at least put in front of all of you. If we don't pull together, everybody's going to go to their corner, which is what we were doing before, and the pandemic will continue. I think that as we learn more, I think our ability to be good American citizens and citizens of the world, to Laura's point, will continue to then make us look elsewhere to try to help other countries make sure that they also resolve this. Otherwise, if there is a group out there where new mutations can happen, we're never going to get out of this. So I think it has created a new world. We're all going to remember life pre-COVID and life post-COVID. I think the mask is now a fashion statement and is going to be even more so. But more importantly, what does it really mean? We need to take care of ourselves and the people around us.
Thank you, everyone. Welcome. Raul, I'd love to stick with you and drill down on this point a little bit. There is quite a bit of a difference. We do have a new president, new administration in the approach. How much does that matter when it comes to really, how do we get specific here on how do we vaccinate a general population, but particularly vulnerable populations who are underserved with services, health, access to healthy food that particularly brought up these comorbidities? How do we really get to these vulnerable populations in the US?
So to start with, one of the major differences that we're starting to see already, and it will continue to magnify, is getting some direction, some guidance, and real help from the federal government to all the different states and municipalities. I think one of the biggest problems we had in the last year or so when I was leading the charge in New York is we couldn't ask anyone. We couldn't ask the CDC or the FDA, what works, or how do we do this, or do you have funding for that? So I think right now we know more about the epidemic, but also we're going to get far more clearer guidance and funding. I mean, we have to make it very clear. Now, building back better, or trying to build a fairer city like New York is trying to do, means that the clinics, instead of being in Manhattan, are going to be out there in the outer boroughs, in communities that need the most. So if you see that the level of infection rated by the number of tests positive in different communities keeps rising, that's where you should go and put the little clinics. And by the way, there is a tremendous number of volunteers. I have gotten several calls from my friends in different cities saying, we want to help. How do we go, get people to vaccinate? Do we need to go door to door? Is this sort of like more of a political campaign? It's a public health campaign that resembles a political campaign, raising awareness and getting people to trust that this vaccine is actually going to be one of the mechanisms. Not because you're vaccinated, that means you're okay. You still have to remember the behavior changes that we are seeing, and that has carried us to a better place now.
Lauren, I want to come to you. You've been a proponent of how targeted philanthropy can really help in testing. Can you explain that to us?
Sure. So here in Massachusetts, where Neighborhood Villages is founded, we partnered with Philanthropy to roll out a pilot for comprehensive surveillance testing for about 550 early educators here in the state, and that population is growing. And I want to say, right, all testing is important. To date, a lot of our focus has been on let's make sure you have access to a symptomatic test and results as quickly as you can. As we move into, as Raul was saying, the sort of extended pandemic experience, and as the vaccine rolls in, we still need to emphasize testing and look at surveillance testing as a way that we pull together, that we keep people healthy, and we move forward towards a post-pandemic world. But surveillance testing for the early education and care field was operationally, sort of difficult. The logistics of it were difficult because it is a field that is very geographically distributed. Early education and care providers might be a single person operating out of their home. It might be a small center of, maybe 10 staff members. So it's not quite as easy, right, as surveillance testing, say, one building, a nursing home. But we said, right, this is a population, our early education and care workforces, they are essential. They are on the front line. They have been there, right, since the first early days of the pandemic. They deserve to have these same public health measures applied to them. And they also themselves, it shouldn't be, but it is, a low wage industry. So they themselves may be coming from communities that have been hardest hit by the pandemic. So we were successful in going to Philanthropy and saying, while we wait for the state to catch up, will you partner with us on creating a comprehensive surveillance testing protocol so that we can bring testing to early educators, keep them safe, and also keep healthy teachers in the classroom so that we can keep our childcare and early education programs open, because families need care solutions in order to go to work, and children should be engaging in early education and care programs, so long as it is a healthy and safe environment. So a very concrete example of how this targeted philanthropic investment has made a huge impact on an entire workforce. And what we're excited is that it's really pushed the state now to roll out surveillance testing programs with an emphasis on K-12, but hope to get them to early education and care, because we've shown that it's doable and we've shown that it works.
Courtney, I want to come to you. In your role advising the UK government on their outreach to about 30 developing nations, you're seeing local impacts in local communities who are underserved. Can you tell us a little bit about the health impacts, but also the economic impacts and what solutions they are looking towards?
Yeah, of course. So as you mentioned, early on in this crisis, I was asked to help lead a team of experts advising the UK government on their response globally. And this has given us an incredible insight into a wide range of both challenges as well as innovations that have occurred, particularly in order to address the very significant impacts of lockdown, which is just as important as the health crisis in many of these countries. There is no doubt that people who have limited resources have been hugely impacted by this crisis, and it's really critical that we all lean in. The World Bank's latest estimates are that the pandemic will push up to an additional 150 million people into extreme poverty. And one of the biggest problems that we have been facing is that the majority of these people are urban informal workers. And most of our systems that we've built for responding to crises are built for the rural poor. But I also really want to stress that one of the biggest lessons from this crisis is that we consistently underestimate the capacities and the capabilities of those most affected. And I think this is really coming through in both Lauren and Raul's comments as well. So a few observations. First of all, many African and Asian nations responded rapidly and immediately knew what to do because through Ebola and SARS, there wasn't any arguing about whether or not to wear a mask. They immediately went into response mode, and in many ways, they were far better equipped than us. Another really great example of the power of local people comes from India. So within a matter of weeks, a network of women's self-help groups had produced and distributed more than 19 million masks, 100,000 liters of sanitizer, and established over 20,000 community kitchens across 27 states, which is no small feat in a place as big as India. We've also seen the incredible power of networks, for example, through a US NGO that used its community networks to deliver more than $8 million in direct cash support through local mothers groups in multiple countries. And all of this was done within a month of lockdown. And a lot of the work that we've been doing through the UK government work has shown that this is months faster than the ability of our international aid architecture to respond. So I would say that the response has required a massive shift in how we think about what we do, what our role is, and has really pushed us to lean into and more directly support the capacities and strengths of local people. But I would emphasize as well that much, much more is needed as the impacts of COVID and the economic lockdown are predicted to reverberate for years to come. So this is not a challenge that will go away soon.
Well, Vanessa, I want to bring you in and ask you about that. In your introduction, you mentioned that you are a parent, which I think is perfect considering right now it is impossible for us to separate our professional and our personal roles and our personal lives. And also, as we think about our children's future, we think about the ripple effects. The World Economic Forum is estimating this year that 1.2 billion children will be out of the classroom. And I think we can all acknowledge out of the classroom is not quite the same as in the classroom. What do you think that we can do to help mitigate the educational inequities that we had in the first place, but will only be exacerbated by this?
Perfect question. And my co-panelists, I think, have covered a fair amount of some of the core issues here. But the reality is that this pandemic has affected every single individual on this earth, whether you realize it or not. Because even if you have managed to cocoon yourself in some way with safety and you have all the resources in the world that has kept your life in a somewhat normal way, the rest of the world is shutting down. And the rest of the world is leaving a lot of people behind because of the inequities. And we see it here in this country based on resource stratification, and we certainly see it globally based on resource stratification. The work that I do at Seed Global Health is about education. It's about training healthcare professionals, doctors, nurses, and midwives. But the reality and one of the issues that we've run into first and foremost, and this is analogous, is that schools are shutting down. So the ability to train or to maintain a pipeline of the most essential people needed to combat a pandemic is being squashed and shut down. And we've been working with governments like in Uganda to help think about how do you reopen schools safely? What is the method to do that? Because that pipeline has to be protected. It's absolutely the same whether you're looking at the pipeline of just core education and early education, K through 12, any education that we're having. This is our pipeline of our future. These are our future inventors, our future engineers, our future teachers. These are the people who are supposed to be leading the country and making decisions. These are the people who just want to put food on the table for their families. And if we can't think very rapidly about prioritizing putting kids in school and getting people back in the classroom, we have a real issue. And I think what it's uncovered is the values issue that we're fundamentally facing, which is what is it that we want to protect and hold dear? And I would argue that our children and education is one of the most important things that we have to do. And that's going to be about testing. It's going to be about contact tracing. It's going to be about adding resources. And it's about really thinking about how this does stratify across inequities and who is the most vulnerable and how are we going to protect those children, and being honest about it, because it's unrealistic to say that we should expect everybody to enter school next fall at the level that people expected them at. We have to start to meet people where they are in this moment and to think very carefully about what does catch up look like, how do we support people through this, and how do we really fundamentally prioritize education. For me, health and education are the two most important things that we can do for our well-being, for opportunity, and to not just survive, but to thrive. And I think that we have to be very realistic that children in inner cities or in the communities that are low resource, that are being held out of classrooms, don't have access to be on Zoom. They may live in a multi-family domicile where it's difficult to concentrate, or they have responsibilities for other people. And it's very difficult to learn in that environment. But rather than punishing them, we have to think very carefully about how do we ensure that we can support them, protect them, and help them have all the opportunity they deserve. Because our future, I mean, it sounds trite, but it is just the fundamental truth that our future will depend on how we respond in this moment, or we'll lose a generation.
Well, thank you so much to all of our panelists. I feel slightly better knowing that you are all involved and look forward to following your work. Thank you.